Very often we all come across the word abscess. In simple terms, abscess can be defined as the pockets filled with pus either in the tissues or in any of the human organs or in any of the spaces in the human body. When such abscess, that is pocket filled pus, is seen in the lungs, such condition is known as lung abscess. Due to the microbial infections, there is a necrosis of the lung tissues, that is, there is a destruction or the death of the lung tissues, forming a formation of the pockets or the cavities which are containing the necrotic debris or the fluid. This is nothing but the lung abscess. Lung abscess is of two types, acute and chronic. If the symptoms are persisting less than 4 weeks, then it is considered as acute, and if it is more than 4 weeks, then it is chronic. Or it can also be classified as primary and secondary based on the absence or presence of the associated condition. In the primary cause of lung abscess, aspiration, it accounts mainly 80 to 90% either through nasopharyngeal or oropharyngeal route. When there is a depression of cough reflex, it straightaway favors to the aspiration, especially during sleep or anesthesia or alcohol intoxication or some drug overdoses or in case of epilepsy, coma, etc. Aspiration is also possible in some of the esophageal disorders like achalasia cardia, gastroesophageal reflux disorder or hiatus hernia, or in the cancers of esophagus. Sometimes due to some pre-existing infections like gingivitis, tonsillar abscess or periodontal infections, etc. will lead to the aspiration. Already pre-existing diseases like pulmonary tuberculosis, necrotizing pneumonias play an important role to cause the lung abscess. In the secondary cause, mainly it includes the mechanical bronchial obstructions and the hematogenous routes. In the mechanical obstructions like lymphadenopathy, tumors or any foreign body obstructions, and through hematogenous spread, that is bacteremia, right-sided endocarditis, septic thrombophlebitis, etc. There are chances of getting lung abscess even through the amoebic liver abscess, and rare causes like hydatid cyst, vasculitis, etc. If we see the pus-filled pockets, usually on the right side or only the single pus-filled pockets are found, it is mainly due to the aspiration cause. Or if there are multiple pus-filled cavities and both the lungs are affected, then we can point it towards the hematogenous spread. Mainly aspiration will affect the right-sided lung. So due to the aspiration of the oral cavity contents, mainly it contains the bacterial inoculum, it straightaway passes down to the lower airways, that is to the lungs. When it reaches the lungs, the bacteria, when it reaches the lungs, mainly the anaerobic bacteria which is passing down from the oral cavity into the lungs, there will be the inflammatory reactions, that is all the inflammatory cells, they start responding it and there will be formation of the cavity. Due to this formation, there will be destruction of the surrounding lung parenchyma where the cavity is being formed. After this formation of the cavity, that is the third stage, there will be obliteration of the cavity and there will be formation of the thick and stiff tissues leading to the fibrosis. Such fibrosis is seen only at the site of the cavity formation. Due to such scarring of lung, tissues get thick and stiff and make it harder to absorb the oxygen into the blood. So what happens now? Usually patient starts the complaint of chest pain, breathlessness, anemia, weakness, tired, fatigue, and also there will be high grade fever. And patient starts to cough with expectoration. Such expectoration will be very much purulent and foul smelling. Early signs of lung abscess includes fever, chills, night sweat, and there will be persistent cough with the expectorations. In the later, the patient may present with the hemoptysis, that is coughing up the blood, and inflammation can even extend to the other parts of the lungs. Some of the complications can include like cerebral abscess, rupture into the pleural cavity, and so on. Now the investigation for lung abscess primarily includes first the chest X-ray. Here in the picture we can see the irregular shaped cavity which is filled with the air and fluid. Here in this cavity it is completely filled with the fluid, or else we can see the darker shadow, that is mainly the fluid level. When the aspiration takes place in the upright position, basically the lower lobes are affected. And if the aspiration takes place when the patient is in the recumbent position, then the superior segment of lower lobes or the posterior segment of the upper lobes are affected. As I said, aspiration is the main cause for the lung abscess and mainly affecting the right sided. If multiple cavities and multiple pus formation cavities, if we are able to see on the x-rays, then we can rule out the cause that it is through the hematogenous or the secondary cause. And second investigation, we can go for contrast enhanced computed tomography of the chest. Here we can see in the picture, it is the picture of the CT scan of the chest, indicating that is the cavity formation in the lungs. And third, we can go for sputum culture, mainly to rule out the anaerobic bacteria. In the general management of the lung abscess patient, mainly the complete rest is been advised, high caloric diet should be provided, and deep breathing exercises has to be practiced. And in the homeopathic approach or the homeopathic management, there are certain medications which will help the patient to get cured with the lung abscess. Medicine like Bryonia alba and Spongia are mainly indicated for the lung abscess or the lung cyst. When the patient feels pressure behind the sternum and pain in the right shoulder, cramping pain in the axilla, and when such complaints gets worse on the movement, we can think of Bryonia alba. When the patient is very much nervous and there is a rapid palpitation and chest pain, he gets up suddenly after midnight with pain and suffocation. When there is wheezing or there is profuse expectoration, we can think of Spongia. Even we can think of antim-tart when there is a rapid, short, difficult breathing, as if it seems like there is suffocation for the patient, but the complaints gets better on lying on the right side, we can think of antim-tart. When there is a burning pain in the chest and there is fastidiousness and also the breathing is very much oppressed and wheezing is heard, then we can think of Arsal. Always remember, homeopathic medicines are to be taken only after the proper consultation with the homeopathic physician. Self-medications could be harmful. Hope this video was helpful. Do like, comment and share. Do follow KK Homeo Hub for more such informations. Thank you.